Hi, I'm Dr. Alan Lacoste. I've been practicing ophthalmology in Lake Charles, Louisiana for 42 years. 4th of July of this year, I was working on a storage building. The panel I was leaning against collapsed. It went forward and I went backwards. I landed on the corner of a 4-inch thick board. A lot of pain. I was transferred to the hospital by ambulance. After arriving there, I had the typical ER workup, x-rays, MRI, etc. The emergency room doctor insisted on me being admitted. The following day, the assessment of the trauma surgeon was that I had 7 broken ribs. There were multiple breaks in a number of these ribs. In addition, there were numerous fractures. After an in-depth discussion, she basically said there was no treatment or surgery for this accident, that they no longer take ribs, and I just basically had to let it heal. The next morning, the same surgeon, her partner, and a cardiothoracic surgeon showed up. We went through the same scenario, 7 broken ribs, etc. There was nothing they could do, that I just had to let it heal. In fact, the cardiothoracic surgeon said, if he operated on me, I'd be worse after the surgery than before. Even with Dilaudid, I was in excruciating pain. Every breath or the slightest movement, I could feel the broken edges of the ribs grinding together. In desperation, I called Jane Weiss, head of the Department of Ophthalmology at the medical school in New Orleans. She referred me to Dr. Bob Batson, who is head of the surgical department. Dr. Batson and I go back many years as we served together on the alumni board of the medical school. After explaining my situation to him, he recommended Dr. Patrick Griffenstein. He indicated Dr. Griffenstein had performed multiple surgical repairs for the type of problem that I had. Within 15 minutes, Dr. Griffenstein called me. He explained the procedure that he followed to fix this problem and assured me he was ready to accept me and transfer to University Medical Center in New Orleans. 7 a.m. on July the 7th, Dr. Griffenstein walked into my hospital room. He explained the surgical procedure in more detail. He answered all my questions, and I knew for the first time I was going to be all right. His professional manner and his caring attitude really put me at ease. So off to the operating room. Post-op, Dr. Griffenstein informed me that when they positioned me for surgery and they rolled me over, that my chest wall collapsed 2 inches. This indicated the severity of this injury. After the surgery, he explained that he placed 11 titanium plates to reduce the major breaks, just like this plate. Doing that reduced the fractures so that he didn't feel anything additional would be necessary. The most amazing thing, I had no pain. I could take a deep breath. I could move around a little bit in the bed. No pain. What an amazing physician and surgeon to be able to take the situation that I was in pre-op and get me to where I was post-op. Very professional, very competent, deeply caring, a real exception in this day and age. On the hospital visits post-op, he always sat down. He was never in a hurry. He answered all my questions. And you know, we always found something to laugh about. He had an entourage with him, residents, interns, medical students, and staff. What a great example for them to see a real surgeon and physician caring for a patient in the way that we hope everybody gets treated. The doctors, nurses, and staff at UMC are exceptional. They were always caring. Every time they walked in the room, it was with an upbeat attitude. I mean, it was phenomenal. I've never experienced anything like that elsewhere. They guided me through a very difficult situation. And for that, I will always and forever be grateful to them. It's hard to believe that I have recovered so well, so quickly, but that is a testimonial to the care and expertise of Dr. Griffenstein and everyone at UMC. 5 weeks post-op, 77 years old, I can use my riding lawnmower to cut the grass. I can do weed eating. I've used the shovel to dig a trench. I'm really back to almost where I was prior to the accident. Incredible, absolutely incredible. Whatever your problem is, whatever difficulty you're experiencing, look for the right person to help you. They're out there. Just have faith in it. And good luck to you, whatever your difficulty is.